But it's like whenever it ends with clinical correlation, it's like, what do you think I'm doing? Do you think I'm
Yeah, I know. I know.
just...
Yeah, I had one of my mentors at work in my residency who told me, try to avoid saying that. People don't like it.
Yeah.
This is The Rounds Table.
All right, welcome back, listeners. Super excited. Different format today. We're actually going to be talking to Dr. Yatin Chadha about a new course he's created. Actually, multiple courses that he's created. I think a lot of you probably already know who Yatin is. He runs the highly popular and successful Beyond MD podcast. But Yatin, why don't you start just by telling your listeners a little bit more about you and your day job?
Yeah, absolutely, Mike. And thanks for having me on again. There's one thing that I always realize is I get very energized talking to you. And you're just that type of person. So thanks again for this.
My pleasure.
My background, I'm a mid-career radiologist out of North York General Hospital in Toronto. So now hitting about 10 years of practice and constantly trying to figure out how to keep work really interesting and how to continue growing at work. Outside of work, I have two boys, I have a lovely wife, and in my free time, I'm back into playing ice hockey this year. My boys have nudged me back into the game.
Right
I
on.
love to play golf in my free time as well. And then I'm really passionate about continuing to pursue my creative projects beyond MD. My podcast is a big one there that keeps me going every day. And then beyond radiology, which we'll dive into a little bit later, these are the courses I created to help my clinician colleagues become more confident with imaging interpretation because I think it's a relative pain point in medical education.
Yeah, I certainly think it's on a long list of things we probably don't get enough training in. And before I forget, I was listening to a recent episode of yours, and you said something to the effect that like you're trying to not say the words clinical correlation is recommended. So I love the fact that you're trying to do less of that. As an internist, it drives me bonkers when the radiologist leaves that in the report.
Yeah, so one of the little games I play with myself is I will allow myself perhaps once a month to say that in a report. And this may be the most complicated case where there's still a lot of pieces of information missing. I will allow myself that time, but generally speaking, Mike, I try to steer away from it.
Yes.
The reason being, talking to you guys, my colleagues, it's not something people really want to see in a report. So instead, I will ask specific questions about the clinical situation, about the blood work, just to show more engagement and to really guide people rather than blanket statements like that. So I hear you.
Yeah, I like that. Like probing questions is super helpful because then I'll read the report and be like, oh, I'm not sure if I did that blood test, or oh, I should check that. But it's like whenever it ends with clinical correlation, it's like, what do you think I'm doing? Do you think I'm
Yeah, I know.
just...
I know. Yeah, I had one of my mentors at work at Queens in my residency who told me, try to avoid saying that. People don't like it.
Yeah.
So it's something that stuck with me.
Yeah. Kudos to that mentor. And then before I forget, Jan, what position do you play in hockey? I'm gonna guess defense.
You betcha. It's evolved over time. I started as a right winger, and then I just evolved into playing defense, started to work on my shot and just being more aware of the ice. And I find when you're playing defense, you get more ice time. So a
Yeah.
bit of a selfish move there.
Yeah, and you're a pretty tall guy too, so it fits the bill. I was a very mediocre goalie. I my brothers both played hockey. I wanted to play hockey. Truth be told, I'm not the best skater, so I became a goalie. But it turns out the best goalies are incredible skaters. Well,
They are. They
yeah,
are.
yeah.
They're incredible skaters. They're incredible at handling the puck. But my son is interested in goalie right now. So that's something we're trying out with him. But that's cool. I remember your story about that.
Yeah, push him away from that. The equipment is incredibly expensive, Yachten.
Maybe less concussions, maybe not. But
Yeah, to be determined. But yeah, so I had seen it might have been either from your podcast or maybe on social media about the course that you created, and I've been working through the CT head imaging for ER physicians. I'm not an ER physician, but I'm learning a lot from doing the course. But it would be great to hear like what was the origin story for this course, and then I know there's another course as well.
yeah. So the first two courses that I created are based on non-contrast CT head imaging. This is a test that is ordered all the time. And from talking to people, how it really came to be, Mike, is when I started to run Beyond MD, my podcast in the early days, I had medical trainees from everywhere reaching out to me on LinkedIn. They were from the States, from Canada, at all levels of training. And they asked me a very simple question. Can you provide us a radiology resource? Because we don't get exposed to too much of this in our training. And I was scratching my head thinking, in all these years, surely somebody has come up with some solution, or surely radiology education has become more standardized across the board. But it turns out it's not the case. So, what I started doing briefly was surveys. I started asking people, yeah, how much radiology education do they get? How comfortable do they feel with their knowledge? And would they find value in a course run by a radiologist? So the responses were very encouraging across the board. And that pushed me to dive deeper.
Right on.
And then one thing I had just learned over the years through my podcast, I love to constantly learn, but I also love to teach. In my early days, I was an MCAT instructor. It even started as early as grade 11 for me when I taught a grade 11 or grade 7 math class for a month. And those seeds to really teach and enjoy that process were instilled in the early days. And then I thought, wow, I love running my podcast. I love sharing knowledge. How can I bring more of this into my own work? And so by asking people what some of the pain points were, CT head imaging came up as one of them because I think there will be most internists on most of their shifts, I believe, will have to be ordering a CT head on their patient. Maybe you want to have a quick glance at it and just make a basic decision on has something significantly changed or is there something significant and acute? And then using your knowledge for sure, you can liaise with the radiologist. But even in our emerge department overnight, there are a lot of dry reads happening on CT heads and in more rural departments. So I wanted to give people more information on this material. And my belief, Mike, is there's really no better feeling when you use your knowledge and your expertise that you have worked really hard to build over the years, and you're able to share that with people and impact them in a positive way. That really drives this course home for me, and this it's kind of what anchors me to this.
Cool. What's a dry read, Yatin?
A dry read. So our radiology or our emerge department is one of the unusual ones in the sense that between the hours of 1 a.m. and let's say 7:30 a.m., any CT heads that are ordered, our emergency physicians will look at it first. There is no radiology read in those hours.
Gotcha.
And early on, people may not feel completely comfortable because it's not an area that is taught rigorously. So I thought if there's value I can add there to help them out in that process.
Yeah, makes sense. I think similar scenario in the Sioux, but I think those radiologists are clocking out at 5:01 p.m.
Hey, how are things going in the Sioux, by the way?
Yeah, yeah. None of the radiologists listen to this podcast, so I can say that openly. But I mean, I love the clinical work up there. It's challenging.
Mhm.
It's challenging, and we think about like sh physician shortages, challenging access to care, like in the GTA. Go up north, and it's like on a whole other level in a bad way.
Okay.
So I will definitely be sharing this information with my ER colleagues up in the Sioux. But like this must have been a tremendous amount of work to bring together. Like how did you find the time for it? And did you keep track of the hours, or was it like, no, I don't want to know. It's a passion project.
A lot of time, Mike. I, I won't share exactly how long. I'll tell you this. In 2010, when I started my radiology residency, one of my closest friends, he's an emergency physician in Vancouver, and we had the idea of back in the day, 15 years ago, starting a course where we could bring radiology education to emergency physicians. We did nothing about it. And then in 2021, I came up with this idea. My wife rightly reminded me, great idea, but where do you have the time? And so what I had to start doing was I had to start intentionally and strategically scaling back on things. So what strategy I used was I got this from a book called Buy Back Your Time by Dan Martell. And I would go through these 2 week stretches of doing time and energy audits. So everything that I was doing, clinical work, podcasting, teaching, whatever it was, I would be documenting that. And then all the activities I was doing over a 2 week time frame, I would be highlighting them in red, yellow, and green. Red was draining my energy, yellow was energy neutral, and green was lifting me up. And so then I asked myself, how can I do more of what lights me up and less of what drains my energy? And so some of the things I did, Mike, I used to pick up a lot of extra clinic work. This would be routine X-ray, routine ultrasound that was not tied to my expertise of musculoskeletal imaging. There would be sometimes 300 cases a week of extra work in the evenings, and I let about 80% of that go because I found that I was being pulled in way too many directions. And we only have so much time, energy, and bandwidth that we can give. And I wanted to give it to the areas I was most interested in. So that was when the idea came, kind of the evolution and how I had to start freeing up time to create the project. It was a lot of time, but I can tell people the one mistake that I made, and I see a lot of other people making, is they will come up with an idea and then they will lock themselves in a room and spend hundreds of hours without actually testing the idea on their target audience.
Right.
So the first time I deliver the course to people, it was abysmal because I realized I made that exact mistake. And so then what I did was I started to create small segments of the course and then I started to deliver it to my target audience and I would collect feedback that I could implement in a timely way and I would take that feedback and I would just iterate and improve. So really just create short snippets, test it on your audience and be nimble and iterate on the go. And I think that's the best way to do things in a more time efficient manner.
Right on. I know, like you're an avid reader, as am I. I was just thinking a good book you should read is called The Mom Test,
Okay.
and it's like how to ask questions when you're spitballing some idea, and you have to ask them in such a way that even your mom feels comfortable telling you that's a bad idea. So
Yeah, that's a great analogy. Yeah.
so definitely, after this, I'll send you an email with a link. I think you'll totally dig the book. But anyway, going back to your course, and like, what's the feedback you've gotten so far? Where do you feel like it's really hitting, and where do you feel like, ooh, next version, I'm going to do something differently?
Great question. One of the pieces of feedback that I have gotten is towards the end of the course or kind of scattered, maybe have a few more summaries because the flagship course, which is ruling out neurosurgical emergencies on a plain CT head, that is 2 hours, just maybe a bit more than that, of DIY content through modules where I'm scrolling through cases, giving people a chance to look and then kind of be active in their learning. So, working on a few more summaries along the way. People have asked for perhaps a few quizzes along the way so that they can actively test their knowledge. And then I will continue to do this as long as it's continuing to bring me joy. But people have also been looking for opportunities where they can be a bit more active with scrolling as well. And so these are all things that I'm taking into account as we think about perhaps some new courses to make to add some value to.
Gotcha. And like, what's been the trick to sort of spread the word about the course? I know the idea of like if you build it, they will come is really not the case for anything. It's like you got to build something, and then you gotta how do you get the word out? Like what's worked out well and what hasn't?
Yeah. Yeah, building is one thing. And then this happened to me too. And I knew it was going to happen. I built it. And then I was like, okay, now how do I share it with people? One thing I found in medicine is because we are a closely connected community, word of mouth does go a long way. So if you have an idea or something you built and you are sharing it with your clinical colleagues, they're generally pretty happy to support you and encourage you along the way. Word of mouth is huge. I will share it in my podcast when it fits in nicely with my content. I will also sometimes write about it from time to time on LinkedIn. That will be a way. And then through avenues like this too, Mike. So thank you for this opportunity, but sharing it on podcasts where there is a medical audience and where they can get value from it because I do believe it ties into their day-to-day work. But getting it out in front of people, this is the new rabbit hole that I am exploring. But my belief is this, that there are certain things that I think most physicians should know how to do. Like when somebody comes in with a wound, you want to be able to close that up. Most people need to know how to generally help to deliver a baby and assess vital signs, resuscitate. I think interpreting a plain CT head is approaching that level of we should have that general knowledge. And the other thing I'll add, Mike, is one thing I found in my career, and I would love to ask you this, but once I hit the 6 to 7 year point, I found that there were stretches in my work where I wasn't really growing. My growth was plateauing. And then just this past year, I decided to really push myself outside my comfort zone and I took on a new challenge, learning nuclear medicine. And I now help cover that for our hospital. But what that experience taught me, Mike, is that growth and joy at work often happens when we're pushing ourselves a little bit
Right.
beyond our comfort zone and when we're operating at the outer edge or the cutting edge and learning new things. So I also encourage other people to think like that. You may find a topic like CT head interpretation daunting or any other medical topic a little bit daunting, but when you push yourself and learn, I do believe it can make your work more exciting, as I have found that new things have rejuvenated me in my career too. But I would love to know from you, Mike, this concept of constantly growing at work, how do you go about it?
Yeah, it's a good question. And before I forget, Yatin, I remember when I was asking trainees when I was on service last, like, oh, like, what are the kids using these days to stay up to date on things, right? And they're like TikTok. We watch TikTok, and I'm like, interesting. I don't think there's any planet where you'll see my mug on TikTok. I feel too far removed from it, but it's like it's kind of it's just like funny to see how much it's changed and how quickly it's changing.
That is so interesting, Mike, because somebody recently told me that I should consider just sharing my content on TikTok because that's where the new generation is. And I never even gave it thought.
Me neither.
But it's interesting that you mentioned
I,
that.
I barely knew it existed until whatever blew up in the media, and then everyone knew what it was. But yeah, it's a good question you asked about like growth, and as a general internist, there are so many things I have to know that I don't know, and I feel as though it's a great part about the job. Sometimes it can be a daunting part, but there's always sort of that like learning new things. And there are certain aspects maybe of the clinical work where I feel like there's a plateauing effect. But when it comes to, new knowledge and new information, I mean, I just love sinking my teeth into something new. So like that is enough to keep me very much excited and engaged. And there are moments where I think, man, if only I was like a dermatologist and I could walk in the room and make the diagnosis and be done and move on, or a cardiologist. There's like five things you can ask me about and nothing else. So and I'm sure maybe also part of the reason why you did nuclear medicine is you probably felt like you want to learn something new. Whereas like the base case for general internal medicine, I always feel like I'm learning new stuff, if that makes sense.
Yeah. No, I appreciate that perspective.
Yeah, and like learning new stuff and then like refreshing on old things that I've clearly
Yeah.
forgotten. So, as I was going through the CT head imaging, it was like, ooh, that's a nice pearl for how to know that this is temporal lobe artifact. You had one on, it seemed like HSV of the brain. I might have learned that in medical school, but I did not remember it. And then learning it again here, I'm like, I never would have known that's where we were going with this one. So
Yeah,
even
yeah,
even
yeah.
if it's like the old stuff you learn again, that definitely I find super rewarding and gratifying. And it's also like humbling how deep you can go with a topic. So recently I was collaborating and having some meetings with experts in Parkinson's disease because GLP-1s might potentially be helpful in Parkinson's. And they were teaching me all of these clinical pearls about Parkinson's. Like, oh man, like it's just like pretty incredible the depth of knowledge somebody can have when they're a specialist in an area. So also in the bucket of, things that I find super gratifying and keep me engaged and excited.
But that concept of depth, Mike, I think is really, really important. And if I can recall from your podcast, you're a fan of GLP-1s, right? Do I have that
Yeah,
correct?
I mean, they're just a remarkable class of medications. Yeah, yeah. Way too
Yeah.
expensive, like prohibitively
Yeah.
expensive, but their patent runs out in January of 2026, so in a few
Okay.
months in Canada. So I really hope it'll lower the bar and make access to those medications a lot easier.
Absolutely.
But anyway, as we start to wrap things up, Yatin, what else do you want listeners to know about the show? We'll include links to it in the show notes, but where else can they find this information?
Yeah. So the links to the courses will be in the show notes, but it's through a website called Thinkific, which is a website that anybody can access to create courses. And the one thing that I want to remind people of is we've all been through a journey, and sometimes we may feel like our journey isn't all that unique, but I can tell you that if you're listening to this podcast, you've probably acquired some unique knowledge in an area or a skill set along the way that there probably are others out there who will want to hear about it and learn from it. And so never be afraid to try something new. That's one thing I learned by putting out the course. And I asked myself this question, if I don't put out the course, will I regret it in 5 years? And the answer to that was a resounding yes for me, which was all the motivation I needed to create it. So if you feel like you're ever going to have that regret, don't hold back. And when you start something new, whether it's a course, a new project, anything, the first few times it can be a little bit messy and you can doubt yourself. But Mike, you've been doing this podcast for a long time, and to put out all the episodes you have over time, the first few, they're not that great, but you have to get through those first few to really build something beautiful. And so I encourage people to think like that and think really long term about the activities that they're pursuing.
Yeah, I like that. And I mean, my go-to is always like hard work beats skill. That's my mantra. Just work hard and, keep after it.
100% every time. Yeah.
But anyway, Yatin, congrats again on pulling this together. I'm looking forward to finishing the course and working through it. And I'm happy to have the chance to talk about it. And I know our listeners will definitely enjoy learning about it and hopefully signing up and learning many things they either forgot or never knew about interpreting CT heads.
Yeah, that's what it's all about, Mike. I think lifelong learning, we all probably had that somewhere in our purpose statement. And I'm not sure if I even mentioned the name of the course, but tied to my theme of Beyond MD, Beyond Radiology. But if you decide to check it out, I hope you find it valuable.
Awesome. Thanks, Yatin. Take care.
Hey, man. Pleasure. Thank you for having me.
The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X. And special thanks to our audio editor, Tamara Van Bakel.